Medi-Cal coverage for former foster youth, presented by Children Now, the Youth Law Center, and Department of Healthcare Services.
I'm just briefly going to say how thrilled we are by how many folks have signed on or are on the phone for this webinar. We have several hundred people on the phone, child welfare advocates, county staff, current and former foster youth, enrollment staff, health advocates, health providers, state policymakers, and many, many others. All joining together with the goal of making sure that all of our former foster youth get the health coverage they need and are eligible for. It's going to take a lot of work on a lot of folks' paths to make sure that we get the word out and achieve our collective goal here. And that's the goal of this webinar, to really get folks on the same page, share some really critical information, and then how we can all work together. Children Now is thrilled to be joined by our partners at the Youth Law Center and DHCS. And my colleagues here at Children Now and the other two organizations will walk you through the webinar slides. So with no further ado, I'm going to turn it over to Alice Bouthier, the Youth Law Center staff attorney, to go over what we're going to cover in today's webinar and take it from there. So Alice.
I will go over what we're going to cover in the next hour. First, we'll do an overview of the law that provides Medi-Cal coverage for former foster youth up to age 26. Then Todd will provide information about the Department of Healthcare Services policy. And we realize that we have a mix of participants on the webinar today, including a lot of county staff. So we'll be covering some of the technical aspects of enrolling youth, but we ask others of you to bear with us because we'll also get to the practical tips for how to enroll and how to overcome barriers that youth may be encountering. Jessica will provide examples of some best practices and some of the things that counties are doing to make sure that youth are able to enroll and get coverage quickly. And we'll conclude with information about outreach activities and some additional resources that are available. So an overview of the law, Affordable Care Act, which is also known as healthcare reform or Obamacare. One of the important goals of the Affordable Care Act is to increase coverage, particularly for individuals who are not insured. One of the largest uninsured populations is young adults, and Congress recognized that young adults may have difficulty in obtaining coverage that is affordable and comprehensive on their own. So the Affordable Care Act allows youth to stay on their parents' insurance up to age 26. Congress also recognized that youth who emancipate from foster care may not have access to health care insurance to their parents. So the Affordable Care Act provides equity through Medicaid or Medi-Cal in California, allowing former foster youth to remain covered up to age 26 as well. In California, we have implemented the Affordable Care Act through state law. One of the state law provisions requires continued enrollment upon emancipation. This means that when foster youth turn 18 or emancipate at an older age, they should automatically be enrolled in this coverage and transferred to a different aid code that Todd is going to talk about in a few minutes. There should be no interruption in coverage, and youth should not be required to file a new application for benefits. The state and the counties are required to have procedures to identify and enroll eligible youth. And the California legislature was particularly concerned about youth who might have lost coverage during 2013 before the Affordable Care Act went into effect. As many of you know, the former foster care child program, before the federal Affordable Care Act went into effect, provided Medi-Cal coverage up to age 21 for former foster youth. And Congress wanted to make sure that these youth were connected with coverage up to age 26 as soon as they were eligible for that coverage. The legislature provided bridge funding for youth who turned 21 during the last half of 2013, and Jessica will talk about that a little bit later, and also required specific outreach activities to make sure that any youth who had lost coverage were able to be enrolled as soon as they became eligible. State law also requires the development of a simplified redetermination form. Federal law requires states to redetermine Medicaid eligibility annually, but allows for a streamlined process in circumstances like this where the criteria for eligibility are very simple and are not likely to change. When youth turn 26, they should not be automatically terminated from coverage. All Medi-Cal recipients have certain rights before their Medi-Cal eligibility is terminated. First, the county has to identify whether the individual is eligible for any other reason. And before terminating eligibility, the county has to provide advance notice or a notice of action, along with an opportunity to appeal if the individual disagrees with the termination decision. Former foster youth who are eligible under this new coverage should not be terminated because of loss of contact, and Todd will talk a little bit about those procedures later on. As I said, the eligibility criteria are simple. In California, in foster care, or in another state in foster care is the primary eligibility criterion for this coverage. All Medi-Cal recipients have to be California residents, and so youth have to be living in California and not establish residency anywhere else. And in addition, the youth has to be under the age of 26. This coverage does not change immigration status, so the immigration rules and citizenship rules for Medi-Cal are the same for this population as they are for any other population. I also wanted to mention that the youth must be in foster care under the responsibility of the state, so this coverage does not extend to youth who are in guardianship or who have been adopted from foster care, although those youth may be eligible for some other reason. There is no income or assets test. Youth should not be asked for financial information when they apply for this coverage, and Todd will go over those criteria a little bit later. In addition, youth who are placed with relatives and in probation-supervised placements are eligible because the only test is whether you were in foster care on your 18th birthday or later. So youth who are placed with relatives through the juvenile court are eligible whether they receive CalWORKS benefits or foster care benefits. And youth who are placed in a foster care placement like a group home, a foster family agency, or even with relatives are eligible even if they're supervised by probation. And now Todd will go over some of these eligibility criteria and how they actually work in practice.
Okay, first we have a quiz. Hector was in foster care in Utah from age 12 to 18. Now he is 24 and lives in California. Is he eligible for Medi-Cal? Yes, California provides Medi-Cal coverage for young adults who are in foster care in another state at age 18 or older. Michael has been in foster care since he was 14. He is now 19 and receiving extended foster care benefits through AB 12. Is Michael eligible for Medi-Cal? Michael is eligible for Medi-Cal as a current foster youth. When he leaves foster care, he will be eligible for Medi-Cal as a former foster youth. Although his aid code will change, he should not have any break in coverage. Karen is 22. She was placed in foster care in California when she was 15. At age 17, she was arrested, adjudicated a delinquent, and placed in a group home. The placement was supervised by probation. Karen remained in the group home until the juvenile court terminated jurisdiction when she turned 18. Is Karen eligible for Medi-Cal? Yes, a group home is a foster care placement. She is eligible as a former foster youth. Now, Jessica will give us a history of the former foster care program.
As Alice previously mentioned, the former foster care children's program existed in California even prior to the Affordable Care Act taking effect. The former foster care children's program is the official name for the Medi-Cal program covering former foster youth. May be helpful for you to have a brief history of the former foster care children's program in order to know what has changed over the course of the last 6 months to a year. Prior to the Affordable Care Act taking effect, as Alice mentioned, former foster youth who were between the ages of 18 and 21 were eligible for Medi-Cal coverage in this program. In order to be eligible, previously, youth had to have been in foster care at age 18 or older, and their coverage could continue up until they reached the age of 21. Recognizing that the Affordable Care Act was going to be taking effect on January 1st, 2014, California budgeted additional funding so that the former foster youth who were already in the former foster care children's program in the 6 months leading up to the ACA wouldn't lose their coverage. California recognized that it would be difficult for these youth to lose their coverage, for example, in August of 2013, have a gap of a few months of coverage, and then be newly eligible once the ACA took effect. The California Bridge funding assured that these youth should not lose their coverage during those 6 months. Now that the ACA has taken effect, what this means is that any foster youth who were in foster care at age 18 or older are now eligible for this program up until the age of 26. This includes youth who are anywhere up to age 26 at this point. So, for example, if an individual was in foster care at age 18 or older and emancipated, is now age 25, they can go and apply for coverage in the former foster care children's program. A common question that comes up is what coverage is available to former foster youth? Former foster youth who receive Medi-Cal coverage are entitled to no-cost, full-scope Medi-Cal coverage. For youth that are eligible and are 21 or older at this point, they receive medical care, vision exams, substance abuse treatment, dental, and mental health services. Former foster youth who are not yet 21 receive some additional services under the early and periodic screening and diagnosis treatment services. What this means is that, for example, a former foster youth who is 21 will receive vision exams under the no-cost, full-scope Medi-Cal program. A youth that is 20, because they qualify for the EPSDT benefits, would receive the vision exams as well as treatment that is determined to be medically necessary. So a 20-year-old former foster youth would also be able to receive contact lenses or glasses that were determined to be medically necessary. I'm now going to turn it over to Todd, who's going to talk to us about why an individual should enroll as a former foster youth, what are the benefits of that, as well as take us through some of the policies that relate to this coverage group.
Okay, why should youth enroll in the former foster care child program? Well, they will maintain continuous coverage until the age of 26 with a simplified redetermination process. There are not any income requirements. The former foster youth qualify regardless of income, and they will stay covered even if their income increases or decreases. The beneficiary has the option of choosing fee-for-service Medi-Cal, and most importantly, there's no cost to the former foster youth, allowing them to save their money for other essentials that they will need in their daily life. I'm going to discuss some of the Department of Healthcare Services policy as it relates to implementing this program. The former foster youth are allowed to self-attest in order to receive immediate enrollment. The way they would do this is if they went into the county office, they would request the Medi-Cal form, the MC250A, which has been revised to define this group as 18 to 26-year-olds. They would fill this out, make sure that the workers in the county office are aware of their former foster care status, and return it and hopefully they'll go through the eligibility determination while they're there in the office and leave with a benefits ID number that will be active probably within 24 hours. So DHCS has provided guidance in regards to the handling of this population. The Medi-Cal Eligibility Division Information Letter 14-05 discusses this population, as well as the Medi-Cal Eligibility Division Information Letter 14-11 discusses some workarounds and system overrides that the workers may need to be aware of in order to get the beneficiaries or applicants into their proper aid code and to ensure that their benefits are available to them. There will be more guidance coming shortly. Also, there should be some FAQs posted that will help give some general information, maybe help county workers and beneficiaries get a little more information. The County Welfare Directors Association has provided a desk aid for county workers. This is very comprehensive. It explains, it has a lot of the criteria that the beneficiaries have or already meet in order to help simplify and streamline the application process. Early in the process, they need to be identified early as former foster youth. So when they walk into the county office, which is the recommended mode of applying for this program, they should go in, and if the county workers don't ask them specifically if they were former foster youth, they should identify themselves as a former foster youth in order to get the one-page MC-250A form. The applicants for this program are not required to fill out the single streamlined application or a full Medi-Cal application. The youth are only required to provide evidence that they are California residents, which that can be verified through the county office, and their age is under 26. Those are the two main criteria that give this group their eligibility. The county will verify the foster care placement after the application has been processed. Once these youth are determined eligible for this program, they will be assigned aid code 4M, and they should remain in this aid code up to age 26. With simplified redetermination yearly, it should be very simple for this group to remain in coverage until a time that they would then come out of this coverage and possibly go into a different coverage. Youth who were in foster care on their 18th birthday, regardless of the aid code they were in, qualify for this program. There may be rare situations where there's a youth who did not have, one of the identified aid codes as a foster care aid code, but they were in fact in a foster care placement. If the county verifies this and determines that they were in foster care placement, they should enroll the youth into the former foster care program and give them the benefits that this program allows them. So for the immediate enrollment and verification, through the process of self-attestation, youth is going to identify that they were in foster care. Some of these youth may need to be asked the question multiple times before you get the answer, or you're going to have youth who will identify this up front. Through this process, they qualify for immediate enrollment so that they can start accessing their benefits, and the county will verify the former foster care status after the fact. The youth do not need to bring in any foster youth documentation or any evidence that they had been in foster care. The counties are encouraged to verify the foster care status. If it's an applicant who's from their county, that should be very easily for the county to identify them as a former foster youth. Or if it's from anywhere within the state of California, the counties can use the child welfare system, case management system, and use that to get verification of former foster care status. If an applicant was in foster care in another state, the county must contact the other state to get the verification necessary to enroll the child into this program or the youth. Further guidance on best practices and people to contact will be coming out from DHCS on some strategies to get verification for the out-of-state youth. These youth should, when they come into the county, they should be processed through the SAWS system and not CalHERS. At the county level, the SAWS is their main system, and they If need be, they should manually override the system to ensure that the youth is in the 4M aid code. Until all of the programming is in place, this may have to be a manual process. The programming is to the point where some of the consortia systems, it is starting to get automated, but we're not completely there with all of the systems being automated and fully functional yet. The county should also verify through the MEDS system that the aid code 4M has posted into MEDS. MEDS is the source that is used by the providers and their point of service machines to verify eligibility, so it is important that MEDS contains the correct aid code and eligibility. If it is not posted correctly, the county should manually assign the 4M aid code. If there's an immediate need situation, the counties shall complete an online MEDS transaction to activate aid code 4M for that same day. And this is a rare case, but it can be done for emergency procedures, even if the youth happens to be getting ready to go to surgery at that moment. There's a process that they can get immediate need situations taken care of. I'm going to now provide some information on the best ways to enroll and some of the barriers that might be experienced by the youth in this process. The best way to apply at this time is to go to the county office and use the MC250A. Walking in the door, identify yourself, go through the process. There are counties who have specific staff in specific offices. You can try calling the county office and identify yourself as a former foster youth and see if they have any numbers that they can give you or direct you to a specific person who can assist you in applying for your benefits. And there's, through this process, there are some counties that will get the whole process going without the youth going into the office to get their benefits. At this time, Covered California is not prepared to accept the former foster youth and handle them appropriately through the online portal. So until all of the programming issues have been taken care of, applying online through Covered California is probably going to create a situation where there's going to be a delay in getting your benefits. So you should probably still go into the county office. And then if the call centers currently do not have a mechanism to identify former foster youth, so until there's been further training and outreach to the call centers and their staff, it's not recommended that you attempt to apply through Covered California. Like I've said, going into the county office is the best option and the most simplified option for applying for this benefit. So some of the barriers that former foster youth have encountered, they've either gone into offices or have called county hotline numbers before some of the special processes were in place and they were given incorrect information. They were told they did not qualify, or that's a different program, and in some instances people weren't even aware of this former foster care child program. Applying online or via the phone, you could experience some significant delays in getting your benefits, which is in direct conflict with the intent of this law. It's to provide immediate eligibility if possible. Also, using Covered California and the online portal, you run the risk of having an incorrect eligibility determination or even being denied benefits and being referred to the exchange for APTCs or another form of coverage. Currently, there's many efforts going on to try and reduce the barriers and make things better for the former foster youth. The counties are receiving additional training and guidance. The County Welfare Directors Association has already provided a desk aid with instructions on how to process the applications for the former foster youth. And the County Welfare Directors Association is working with individual counties to identify liaisons or specific offices that the youth can go into and apply for their coverage. The Department of Health Care Services and the County Welfare Directors Association, as well as other county agencies, are trying to identify and troubleshoot systemic errors in order to make the interfaces between the multiple computer systems work better and ensure coverage for this group. Counties have also received direction to manually override the county systems to ensure that the youth are found eligible and placed into the correct aid code. And these manual overrides and guidance are in effect until all the programming fixes are made to the SAWS systems. And also covered California Department of Healthcare Services with CalHERS are working on the programming issues at that level to identify and flag the former foster youth appropriately so that they will be placed in correct coverage. All of this is going to take a little bit of time, but when it's all done, it should provide a much better experience for the youth than we currently have. So Covered California and Department of Healthcare Services are working on programming fixes to make this a better experience for the youth applying for this benefit. And now Jessica will provide some tips and best practice guidance.
Thank you, Todd. That was a lot of great information, and some of it I know was quite technical, and just want to make sure to do a bit of a recap because it was really important to get that technical information, especially for the county folks that have been on the line. But we also want to make sure that people that are a little less familiar with some of the details also know what to walk away from this training with. In terms of enrollment tips and reminders, this program and the extension up to age 26 is new, and so we understand that people are still learning about it. And until everyone gets up to speed, there are certain things that a former foster youth can say when they go into a county office that may aid in making sure that the process is streamlined and that they get enrolled in the correct program. And some things to remember, and that a former foster youth or someone helping a former foster youth can say when they encounter someone that's not familiar with this program are the following. Former foster youth should be enrolled in the Former Foster Care Child Coverage Group. As we talked about previously, that is the official name of the Medi-Cal program for former foster youth. Former foster youth should be assigned the 4M aid code. As Todd talked about earlier, there's a number of advantages to being assigned the 4M aid code and designated in this former foster care child coverage group, which includes the ability to stay enrolled in this group into the age of 26. It also includes some additional flexibility in terms of being able to elect or choose fee-for-service coverage, allowing former foster youth to see any doctor that takes Medi-Cal rather than having to choose a managed care plan and be limited to certain providers. Additionally, because former foster youth qualify regardless of income, they do not have to provide income information when they go to apply. And if asked for income information, a former foster youth should tell the person asking them for this information that that's not necessary information for them to provide. Former foster youth, as has previously been mentioned, do not need to fill out the full Medi-Cal application. They just need to fill out the MC-250A form, which is a much simpler application that only solicits the information needed to put someone into this former foster youth group. Something that's important to note is that some former foster youth will know to self-identify as someone that was in foster care at age 18 or older, but not all individuals that may qualify for this program may come into an office and say, I'm a former foster youth, I qualify for this program. So it's really critical that frontline staff be asking this question so that they can streamline the process and make sure that a former foster youth does not have to fill out the full Medi-Cal application. Another important point with that is that if a individual who is in foster care at age 18 or older does not know that there is some benefit tied to having aged out of foster care, they may not self-disclose the information. So it's really critical that that staff ask the question and ensure that the former foster youth don't have to fill out the full Medi-Cal application if they may be eligible for the former foster care children's program. Additionally, former foster youth do not have to provide proof that they were in foster care at age 18 or older. The county will verify this information, and once an individual has indicated that they were in foster care at age 18 or older, they should be immediately placed into this coverage group, and the county will then, after enrolling them in the coverage group, go through the process of verifying that former foster care status. to that end, because former foster youth should be immediately enrolled in coverage, as Todd previously mentioned, a youth should receive a Medi-Cal benefits number before they leave the county social service agency office. The application should be able to be processed in the county system, even if it may take a day or two to reflect in the med system that the provider actually sees. Again, because this is a new program, not everyone is yet aware of it, and so it may be helpful for a former foster youth to bring some of the guidance that's been issued from DHCS or CWDA with them when they go to a county office to apply. The person bringing the information, the guidance, doesn't need to fully understand it, but it just may be helpful to be able to provide some official information on the program in the event that the person helping to enroll the former foster youth is not yet familiar with the program. We've talked a bit about some of the enrollment barriers that former foster youth have experienced when they've tried to go enroll. However, there's also a number of best practices that we want to highlight. And these are best practices that we've seen coming out of counties that are really trying to help former foster youth and get them enrolled in the right coverage group. Some examples of things that counties can do to help this particular population is to, one, designate a specific point person or phone number for a former foster youth to call to enroll. We've provided some examples of some counties that have already done this. This is not an exhaustive list, and there may be a number of additional counties that have designated a specific point person or phone number. The reason that this is a best practice and really helps former foster youth is it allows someone who qualifies for this program to get into contact with someone that has been designated to oversee this program and is already aware of the criteria for it and how to help process the applications. This ensures that the former foster youth can more quickly enroll in the correct coverage group, is less likely to encounter incorrect information. Additionally, some counties may not have a specific person or number to call, but they may have identified a specific staff member for this population to ask for if they go in person to a county Medi-Cal office. Again, this is a best practice because it ensures that a individual who qualifies for this program is more likely to encounter someone that is familiar with it and able to quickly process their application and ensure that they are enrolled in the right coverage group. This is also important because, as Todd previously mentioned, not all of the systems, including the electronic systems, are in a place where someone who qualifies for this program can easily be enrolled in the correct aid code. There may be some needs for overrides or workarounds, and by identifying a specific staff member at a county office that's familiar with the program, this ensures that that person is familiar with the workarounds that are needed to help the former foster youth enroll in the correct coverage. It's also a best practice for some counties have partnered with service providers that are working with transition age youth. And this is great from a number of standpoints. One, it aids in outreach. So it's a way of helping to identify youth who may be eligible for the program and let them know that they're eligible. But it's also great because it helps for former foster youth to have a service provider that they're working with to support them through the process of enrolling in this coverage and ensure that their applications are processed in a timely manner. We wanted to spotlight one particular county that has taken a number of different tactics to try and help this population easily enroll in coverage. Santa Clara County has developed 3 easy ways for former foster youth to sign up for the Medi-Cal program for former foster youth. And these are 3 ways they can sign up without ever visiting a local county office. A former foster youth can meet with a designated county social worker during his drop-in hours at the Hub, and the Hub is a youth-led resource center for current and former foster youth. This is an example of a county that has partnered with others that are working with the former foster youth population to provide support in enrolling in this program. Youth can also contact the designated county social worker to make an appointment to meet at another time if they're not available during the social worker's drop-in hours. Additionally, youth can call the county's foster care eligibility unit, which is a specific designated number that youth can call to enroll in this group. Legal Advocates for Children and Youth is also available to provide support if youth encounter problems trying to enroll in Santa Clara County. And Santa Clara County has really a number of different entities, including legal advocates, county staff, and community-based organizations have come together to try and help this population get their coverage. A number of outreach efforts have been going on as well to try and help raise awareness about the new coverage up to age 26 for youth who aged out of foster care. One such outreach campaign is the Covered Till 26 campaign that Children Now is spearheading. Covered Till 26 is a statewide outreach campaign intended to ensure all former foster youth living in California know they're eligible for Medi-Cal coverage until age 26. This campaign is targeted to reach many audiences, including youth themselves. My colleague Fatima Morales is based in our Southern California and is spearheading our outreach efforts related to Covered Till 26. Again, this is aimed at increasing awareness both amongst youth themselves as well as amongst stakeholders and health care providers and other advocates. We are partnering with California Youth Connection to use youth ambassadors to also spread the word. Often youth can be better messengers of this information to other youth as they're a trusted source of information. There are a number of Covered Till 26 resources that Children Now has put together. One is a youth-friendly website, which can be accessed at coveredtill26.org. We've also developed a number of outreach materials that are shareable and downloadable from our site and are available for trainings and presentations. One of our resources that I want to talk a little bit more about is the county contact list. I've just spoken a little bit about the best practices that have been identified in certain counties to help former foster youth enroll in this coverage. As part of our efforts to identify best practices, we have put together a list of the best ways to apply when we've been able to identify them in a specific county. This list is growing, and we're working with our partners over at the County Welfare Directors Association to build this list. But you can find this by going to our How to Sign Up page on the Covered Till 26 website. Additionally, if you're aware of a best practice in your county and that is not reflected on our list, please let us know, as we want to make sure that that information is available to help streamline enrollment for youth throughout the state. A number of additional resources exist as well regarding this program. The Foster Care Ombudsman is an amazing resource for youth who are having trouble signing up. This is also a resource for youth who may not be sure if they were in foster care at age 18 or older. The Foster Care Ombudsman has access to the child welfare system database in order to be able to look up for a specific youth whether or not he or she was in foster care at age 18 or older in California. Additionally, the Youth Law Center has devoted and created a website or a web page with more information about federal and state law and policies surrounding the Medi-Cal extension until age 26 for former foster youth. And this is a great resource where a lot of additional information can be located. Throughout our presentation today, we've discussed a lot of different forms of guidance that have come out, and much of this guidance, as well as the MC250A form that former foster youth can use to apply for coverage, is available online. And we've provided you with the links for where to find this information online. Todd Johnson, who has generously joined us today and provided some great information for everyone on the DHCS policies and processing of these applications, is also available to answer questions regarding the guidance or to provide additional information that's needed about the former foster care children's program. Thanks to everyone for participating in our webinar, and feel free to contact myself, Alice, or Todd with any additional questions that you have after watching the webinar.